Why me? Why now? Why Ava Health? I think for me, I've reached a position in my career where I've made a lot of mistakes, and I've learned a lot from what I've done. And I've also been able to take some of those mistakes and understand them a little bit more effectively, which has, again, helped probably soften me to being open to other ways of working. So I know that there was a time when I used to confront clients very heavily, and I used to try to force them to take on values that necessarily weren't maybe their values. And I remember really about 6 years ago, right at the cusp as I began to move towards a different way of working with people, I remember working with a client. He was coming into our outpatient program. It was partial care with supported housing wrapped around in a Florida-based model program. And he had chronic pain. He was an employed guy. He had a family. And so I knew this little bit about him. So they were admitting him into the program, and midway through the admission, he decided he didn't want to be there. He came outside, and he was standing outside, and I came out and started to talk to him. And I will tell you, one of my values is my children are the most important people in my life. And so I made an assumption that they were the most important people in his life. You know, Anise Nin says, one of my problems is I see people as I am, not as they are. And so I looked at him and I said, you know, if this was really meaningful for you, you would do this for your kids. It's an awful, awful thing to say, even though it came out of a place of like really wanting to help, really wanting him to stay in treatment and make progress. But he's the expert on him. And he turned around and said to me, who are you to try and say that to me? That is so manipulative. And I thought, gosh, he's absolutely right. It was really manipulative and it wasn't appropriate. And in the end, what it didn't do was, it didn't achieve the outcome that I wanted. It didn't achieve me trying to bond and connect with him. It actually created a barrier between the two of us. And so it was from that moment that I started to then engage in a different way of working with people. I went and spent some time doing peer recovery work down across the state of Maryland in hospitals, doing interventions, training peers how to do this. And it really helped me to embrace, again, the notion that Miller and Rolnick talk a lot about in motivational engineering, which is the client is the expert on the client, number one. And so we have to really listen to them. So we need to stop talking as much and listen more to what they say. And in that case, then it's really, really vital and important that if I accept that, then I really want them to guide the care and I can work with them. And the question is, can I do that in what is a very programmatic driven or system driven treatment program? And I have attempted that twice and been relatively successful to determine that yes, we could do it, but those weren't the right ones. And so the right one came along, which is to partner with two people who are fantastic and who embrace fully this notion that the clients guide us and we work alongside the clients. And that's not an ego issue for me anymore. I don't have to be right. I don't have to have the answer because I know the client has the answer.
Hello, Ava Health.